Hi everyone, this is Junaid again with AI NeuroCare. I'm one of the neurocare and epilepsy physicians. Grateful that you're here. Today we're going to have a fireside chat with Dr. Bhatti. Danish is a very good friend of mine. He's a specialist in movement disorder and has been a curriculum developer for both neurology and movement disorders. He has dedicated his life for medical education, and he has not only just done that, he has actually innovated it by producing hybrid mini fellowship courses for movement disorders. So I'm very grateful that he's with us today. Hi, Danish. Thank you so much for joining us. Do you mind introducing and adding something that I've missed on my introduction?
Thanks, Junaid. Thanks for having me here. I do like to build online courses. I'm working as a faculty in University of Nebraska Medical Center as an associate professor, and I founded and I direct this international neurology program, which was one of my most interests in to develop courses for distance learning for other countries and for international physicians and graduates.
Awesome. Yeah, and that distance learning portion, and especially the way that you have produced these hybrid courses, is just truly innovative, especially in medicine, because we are really thinking most of it the time at bedside, but as more and more post-pandemic telehealth, we have now realizing that medicine not only should be practiced website, but actually educated through these modern technologies. And this is truly going to be the future of education in general and in medicine in particular. So we are both partnering to actually create courses and helping each other. So one of the courses that you were very interested in, I would love you to actually give us the title, the headline, and what it is all about.
Sure. So we're collaborating on developing this course called A Guide to Getting into Residency in the United States. So it's basically a course that provides some direction to people who are looking to apply for residency in U.S. in how to improve their odds, how to polish their application and find various weaknesses and how to improve upon them as they go through the process of residency or finding the residency. I actually started being introduced to this concept of international graduates looking for residency program when I started as a director of the observership program at University of Nebraska Medical Center about 5 or 6 years ago. So I've reviewed hundreds of applications, and I've had more than 70 observers over the last 6 years at University of Nebraska Medical Center, and that continued to give me a perspective on how tough it is to get into a residency program, how many things you're not familiar with, you've never been taught or told, and very simple things that we take for granted are very obvious to us are just a mystery to these applicants.
No, that's a very fantastic insight, and it's actually all about giving insider insight and to actually have what as we normally say, to put the other shoe on your foot so that you understand really how to walk in someone else's shoe. Because the minute you have the mindset of what the program director, the program is thinking, then you can actually redesign your whole approach. And this way you can improve the chances. Of course, we can't promise anyone that takes the course to get into a residency, but clearly decreasing the amount of silly mistakes, increasing the superficial sometimes and even deeper values of what programs and program directors are looking for, you can improve your odds, and if nothing else, you're going to decrease the time to get to that result. So that's fantastic, and that's what we are really looking into. I personally have similar experiences, but I didn't have the backing of academics. I actually did it in a private situation, and I did have observers that came in through, helped them with their RAS applications, interviews, and everything, etc. Before we get into the whole modules and what we're going to discuss throughout these course, which is going to be some of these chats, some of the program directors are going to come, I wanted to first clarify for everyone who is this program not for, so that there is no confusion.
Yeah, so I think it's important to distinguish that because there is a general perception of what these kind of courses are for. So, we are not developing something that's already there. So this is not a course that will tell them how to get high scores on USMLE, for example, the licensing exam. This is not a course where we're telling them, that we'll give you a letter of recommendation or, we'll tell you all the questions that you will get in your interview. We are not trying to create kind of a a walkthrough for them. Okay, step 1 is this, and step 2 is this. How to log into ECFMG websites and things like that. There are enough resources out there for that, and what we're really trying to address is what's missing in those available resources.
Awesome. Yes, correct. And the mindset questions, the important ways in which you can distinguish yourselves, and if there are any deficiencies, how to actually improve on them with different areas in your own CV, or even if you are addressed with those questions, how to actually approach in a way that you can actually minimize the impact of your deficiencies and improve and highlight your advantages. So we all have unfair advantages. Some people have visas, some people have good scores. Those are different advantages and disadvantages. Some people just doesn't seem to pass step 2 CS. So there are different areas that we are also going to touch on so that we actually can produce these results. So from a broad overview perspective, how are you going to divide this course into, different chapters, modules? Give us a high 60,000 degree view of how this course is going to be structured.
Yeah, so I think what we have been discussing is identifying the key elements or aspects where guidance or mentoring is needed. So I think we've settled on kind of a structure of 8 modules that we will divide this course on. Touching on various important aspects of the course, so things like an overall general view of what residency application is all about, how to get into a mindset of an applicant, what is an overview of a residency selection process, not only from the applicant side but also from the program side. What are we looking at when we're selecting applicants? And then what are the things that help you stand out and get a invite for interview? How do you prepare for interview? What are the things that we look for during the interview? And then, how ranking will work? What are the factors that go into ranking? And, after match, how does scrambling work? And so on and so forth. And we will complement this kind of a base structure with guest interviews like you mentioned earlier.
Awesome. That would be great, because I was really astounded by the amount of information that I got. My sister, Sarah, who actually is an associate program director, which is also going to come on the show to provide her insight, especially more recently within this pandemic year, things have been significantly haphazard. Traveling has been an issue. Danish, in your opinion, do you think we're going to go back to 100% in-person interviews, or there will be a percentage of video interviews that will still going to be
I think
happening?
there will continue to be quite a bit of a percentage of interviews. People are gotten used to it. There are programs where you want to interview where the dates don't match. You have to remember that many American grads are actually interviewing during their final year of medical school. So they still have rotations, they still have other ongoing assignments, and they have a limited number of vacation days. So it's not going to be the international medical graduates that will drive the need for tele-interviews on Zoom base or online interviews. It will be the American graduates who are so used to technology, and someone like us who are coming from other countries might think if we don't show up in person, that might give a lower our chances. But American graduates don't have those kind of concerns, and they will push for the options of continuing to tele-interviews even when in-person interviews start.
Do you think because of just this tele-interview or virtual interviews, there are going to be a significant shift in mindset? I mean, there's clearly going to be shift in the number of applicants, the amount of programs you're going to apply for, etc. Because, at the end of the day, if you're doing virtual interviews, the amount of interviews that you can do are more. So American medical graduates end up doing more interviews, even though they're not going to match in all of them, clearly. But what I'm saying is that, do you think that there is going to be a shift in a strategy from an international medical graduate perspective that things can actually move differently?
I think so. I think there will be both pluses and minuses. There will be advantages of being able to interview even from your home country. And as I've seen people interviewing, and I know I was giving grand round and I saw applicants who were in the middle of night attending the grand rounds as part of their ongoing tele-interviews. There are some people who would just shine more on video-based interviews. They feel awkward when they're in company, especially if they don't know many people. And some people are just very natural among others in person, but may not do as well on tele-interview. So there will be some changes, both pluses and minuses.
Correct, and we will be doing some, practice interviews between us or some, pseudo applicants, not real applicants, to actually just give you a sense how to dress, how to talk, how to make sure between the three things, audio, lighting, and framing, so that you can see this boxed appearance of how things are showing up. So idea is to actually, very simple tweaks can make a huge difference as far as improving your odds. At the end of the day, these are very small tweaks, but they add up, and that's the whole idea, increasing your odds. I mean, we cannot, of course, confirm or help you directly with any residency applications. Just that's what I personally want to clarify again. We are not going to offer any letter of recommendations. We're not offering any clinical experience or clinical expertise. We're not offering that we're going to call the program directors on your behalf if you take the course. What we are offering here is understanding the true mindset of what the program is looking for, and you develop the whole, and help you develop the strategy so you streamline the whole process, saving you time and money, because people sometimes spend 660, 70 applications that can come out to $9,000 to $10,000, and this will help you to actually make sure that you do not spend that money and use that cost separately in different times, and also that also saves you time as well. So the question is, make it more efficient.
So if I add there, it's I'm running this online course, which is basically an introduction to neurology residency, which came out from this idea of a virtual observership that people were not getting last year, in-person observership. But that course is not about teaching how to apply for residency, but even in that course, I meet with them every 6 weeks or so, and it's amazing how many things there are that people are not familiar with. They don't know what they're missing. So that reminds me of, I think it was Henry Kissinger that said there are known knowns and there are known unknowns and there are unknown unknowns. And there are so many unknown unknowns, things that people don't even know that they're missing, that it's amazing how we survive this process. If I just give a quick example, I was last meeting I had with them, I was reviewing what kind of things to add to your resume, and it's unbelievable that how many wonderful experiences people are doing, volunteering for COVID camps and clinics, and arranging all these kind of vaccination drives and things like that they never think about putting on their resume. And then it's not just that even if you're putting on resume, there's a smart way of doing it. So for example, if you have been helping putting like a COVID vaccination drive, the best way to do it will be to just reach out to the people who are the administrator, ask for a letter of appreciation to say that you have done hard work, and now it goes into your honors and awards. So things that you have done, things you probably have been appreciated for verbally, but never given in a way or structure, and you never thought that can go into your honors and awards. And there were countless such examples during that meeting.
Correct. That's a fantastic example. Before we shut down for the day, I always like to know the faculty. So 3 interesting facts about Danish, and then 3 interesting reads that I should do that you recommend. 3 interesting
facts. Number 1 will be that I learned to play guitar during my medical school, and then I kept playing it during my early residency, but then gave up on it, and I restarted doing it very recently. Second interesting fact will be that I love to read books on economics, history of economics, and financial implications. So these days I've been reading on Austrian economics by von Mises. And then third thing will be I love gardening. I love growing vegetable plants, and I love growing fruit trees. And that's what I've been busy with this afternoon. 3 interesting read I will say will be great. Number 1, the Sovereign Individual. That's by a not very well known British lord who wrote that book. It's a very, very thought-provoking book. Human Factor, I think that's by Von Mises. That's an interesting one that I've queued to read about Austrian. And then the third one that I'm reading right now is called The Tao of Capital. So that is also a very strange kind of a book, but has lessons in economics, but beyond economics.
Beautiful. Excellent. So my three interesting reads would be The Art of Motorcycle Maintenance.
Robert Brisig.
This is one of the great book. Beautiful book, must read. The second would be The 7 Habits of Highly Effective People by Stephen R. Covey. I think that's, I made sure that my younger brothers actually took a weekend and read with them, because that's such an important book in my opinion. And the third and the last would be Homo Sapien, A Brief History. That actually goes through the complete
Harari. I'm actually on the
narrative, how we have been.
I'm listening to it on Audible. So.
It was a pleasure having you. Thank you, Danish. We'll keep continuing with these conversations.
Awesome.
Thank you for your time.
Thanks.